So if you would like to hear this training in English, go ahead and tap on your globe. You're going to be able to see it on the bottom of your screen. Also, if you want to see these slides in English, then you can see the three dots and you can go ahead and select English. Next slide, Alma, please.
Bienvenidos a nuestra presentación de hoy. El que busca encuentra.
Hello, welcome to our presentation for today, those who seek find. My name is Marta Alvarado. Thank you so much for being here. Before we begin, I do want to inform you that later today, I am going to be sending you a link to all the recordings in the evaluation. In the evaluation link, you will also be able to find and request our comment book. If at any time you have a question, you can raise your virtual hand by clicking on raise hand icon in the Zoom toolbar. You can also type your questions in the chat and we'll answer them at the end of the presentation. Next slide, please. So we are part of a nonprofit organization called Migrant Clinicians Network, or MCN. We are a force committed to health justice. Our mission is to create practical solutions at the intersection of vulnerability, migration, and health. Our vision is as a just and equitable world in terms of health, where immigration is never a barrier to well-being. If you would like to learn more, go to MC and please visit our website. Now I would like to quickly introduce our presenter, Alma Galvan. She is the MCN Director of Training and Community Engagement. She has worked for more than 3 decades to improve the health of migrant and seasonal agriculture workers. She also has extensive experience providing technical assistance and developing curriculum and educational materials for adults with limited English proficiency, low literacy levels, as well as community health workers, health professionals, health educators, and physicians. Welcome. Thank you so much for being here. Marta, thank you so much. It's a pleasure being here with all of you. And so let's go ahead and begin because we have about an hour. Today, we are going to try to introduce to you guys a comic book that we have developed to better the understanding of the health care system in the United States. We want you guys to get familiar with this comic book as a tool so that you can use it with the people that you work with, or even with people that come into this country that are new here. We're also going to recognize popular education strategies to use this comic book in their daily practice. And also, we are going to try to identify ideas of educational and local communities for the health system. So let's go ahead and begin. And we're going to begin with one question. And this is going to be a very interactive session. And in the chat, we want you guys to respond. What barriers do newcomers to this community face in relation to the health system? What are your thoughts? Someone said access, language, transportation, insurance, the cost. Yeah, if you're disoriented, you don't know, of course, the language. How do we do it? Yes, financial assistance. Yes, it's expensive. It's hard to navigate all of it. Where to begin? Where do we begin? And this is where we're going to begin. Where do we begin? Thank you so much for your comments. We are going to have some considerations for today, and I'm going to begin to introduce our different characters. So some of our considerations is the health literacy. This is a concept in which It's
personas
supposed to be
entienden,
what
¿sí?
people
Lo que las
understand.
personas comprenden
It's supposed to
de
be
la
what people
información que se les
understand of
proporciona
the
en el sistema
language
de
that
salud
is
y cómo
being
lo
given to
utilizan
them in the health
para
system. And
obtener
how do
esos
they
servicios de
utilize
salud
it to
para ellos
obtain these
y
services
para las
for them
personas que viven
and
alrededor
also
de
for
ellos,
the people
con el
that live
objetivo
around
de
them with
protegerse,
the
prevenir
objective to protect
enfermedades y
themselves,
manejarlas mejor
to prevent
cuando
illness and better
aparecen.
manage
Pero
illness
esta
when it
es la
occurs.
alfabetización
And
en
so
salud
this is
de las
health
personas. ¿Qué
literacy.
tanto pueden navegar el
It's
sistema?
how
Pero
much
también
can
hay
they
otra parte
navigate
muy
the system?
importante que es la
But we also have another
alfabetización
very
en
important
salud
punch,
de las
which is the
organizaciones
health
que
literacy,
trabajamos
which with
con
the
estas
organizations
personas.
that we are
Entonces,
working, that are
este es
working
un
with these
grado en
people.
que estas
And so
organizaciones,
this
centros de
is the
salud,
degree to which
departamentos de
organizations
salud,
enable
ONGs,
individuals
sistemas de salud,
or
permiten a
health
las
systems
personas comprender
enable
y
individuals to
utilizar de manera
understand and
equitativa
to
la
find
información. Es
an
decir, que la
equitable use
presentan
of
de una
information.
manera
In other words,
sencilla,
they present it
simple,
in a very
clara,
simple
para que
way, in
las
a very
personas
clear way,
puedan
so that
tomar
people can
decisiones, puedan
make
informarse
decisions
sobre los
and can
servicios
be
y puedan
informed
actuar
of the
para prevenir
services
estas
and
enfermedades.
make
Entonces,
decisions to
es una
prevent
cuestión
these
50
illnesses.
y
And so
50.
this is a matter of
Entonces,
50-50.
nosotros como personas que trabajamos
And
en
so
el sector
we, as
salud,
people that work
pues
in the health
debemos de
system,
alguna manera de saber
we should and
sobre
need to know
el sistema de salud. Y yo
about the
nada más
health
les quiero
system.
presentar esta
And I just want to
diapositiva así. Hay
present this
10
slide to you.
diferentes
They are
conceptos.
10 different
Léanlos, por
concepts.
favor.
Read
Y
them, please.
díganme si ustedes los pueden
And
entender
tell me
y
if you are
explicar
able to
estas
understand
palabras,
them and to
estas
explain
frases
these words
comunes
or these
en palabras
common
sencillas, que
phrases
ustedes se lo
and
pueden
very
explicar a
common or
cualquier otra
simple
persona.
words. If you were
Entonces
able
quiero
to
que me
explain
digan
this to
cuántas de
somebody else.
estas
Now,
ustedes
I would like
no
for you to tell
pueden
me how
explicar,
many of
cuántas
these
no
words
pueden explicar.
or terms you are
Y les voy a dar
not able
algunas
to
nada más para que me
explain to
digan.
somebody
Son
else.
10.
And then I'll give you a
Pónganmelo
moment to tell
qué
me.
tantos.
So go ahead and type on the chat.
Jaundice, no se puede. Tamizaje
Jaundice,
tampoco.
yes.
María Eugenia dice que todas no las
Maria
puede
Eugenia
explicar.
is saying that she's not able to explain neither any of them.
Jaundice, ajá.
Jaundice,
Es
yes.
ictericia. Osteoporosis. Me
Osteoporosis.
parece que jaundice es
So it seems like jaundice is
que es más. Puedo
the word
explicarlas
that
todas,
it's the
Roxana.
most
Gracias,
common.
Roxana.
Roxana said I can explain them
Osteoporosis.
all.
Bueno,
Osteoporosis.
pues esto es
Very
así
well.
una forma bien rápida
So
de
this is just a
saber
very
cuál es
quick
nuestro
way
nivel
to
de
know
alfabetización, qué
what
tanto
is our
nosotros
literacy
sabemos. Y
level.
recuerden que yo
How much
entiendo
do
que
we
todos
know?
nosotros
And I
somos
know,
parte
I
del sector
understand
salud.
that
Es
all of
decir,
us are
todos
part of the
estamos
health
trabajando de
system.
una u otra
We
manera
are all working
en
in one way
proveer
or
servicios
another
de salud,
in
ya sea
providing
desde descuido en
healthcare
persona hasta el
services,
final, cuando está recibiendo tratamiento, ¿no?
whether we are
Entonces, esto es
caring for
nada más
someone
para que
until the
ustedes
end when they're receiving
reflexionen
treatment. And so
en
these are
qué
just some
es
words so
esto.
that you can self-assess
Alfabetización en
yourself.
salud no es solamente conocer las
Health
palabras, sino es
literacy, it's not just to
comunicarse
know the words,
con
but it's
ellas,
also to
poder
be able to
escribirlas y
communicate
poder
with them, to be able to
decírtelas,
write them, to
poder
be able
utilizar los
to
números y
share
las
about them and share
matemáticas,
the
por ejemplo, para
numbers and
leer
the
una
math.
receta,
For
para saber
example, when you
cómo
read a
es, cómo
recipe,
usted se va a aplicar una
or
pomada o
or for
unas
example,
gotas o lo que necesite,
oh, okay,
y de cómo
when you
y
need to maybe
explicarle a las
apply
personas
an
que están en
ointment or
recepción
take a
qué es lo que
medication
necesitan
and be
o a
able to
una persona que
explain
le
to
va a
those that are
atender.
in
Entonces,
reception,
son
to
todas
explain
estas
what you
cosas,
need
¿no?
or someone
Pero
that's able
casi
to help you.
siempre
And so it's really all of
hablamos
these
de
things.
las
Most
personas
of
que
the
van a
time, we
recibir el
talk
servicio
about
y
the
no
people that
hablamos
are
de
going to
nosotros como
be
los proveedores
receiving this
de
service, but we
servicios
don't
de salud.
talk about us
Entonces,
as the
esta es
health
una
providers.
consideración
And
muy,
so
muy
this is just a
importante que
really
ustedes deben
important
de tener en cuenta.
consideration that you guys
Y bueno,
should
con
know.
esto les quiero
And
comentar
so
que la
with this, I do
alfabetización en
want to
salud en
comment
este
the
país
health
es un
literacy
atributo.
in this
No es nada
country
más
is an
hablar por hablarse,
attribute.
no es
It's
algo,
not
es
just
una habilidad
to
que
say
le
words just
permite
to
a una
say them, but
persona
it's an
tener
ability
control
that
sobre
allows
su
someone
salud,
to have
sobre
control
su
of their
persona. Y
own
recuerden que
health,
salud es
of
un
their own
concepto muy
person.
amplio.
And remember,
Entonces,
health
le
is a
permite
very big concept.
comprenderse y
And so
buscar
it
recursos.
allows you to understand and to
Y
seek
fíjense
what
que
you are
solamente el
needing.
12%
And
de
let me
los
tell you,
adultos en los
only
Estados
12%
Unidos
of
tiene una
adults in the United
alfabetización
States
competente,
have
¿sí?
proficient
Esto
health
es
literacy.
información de la
This is
encuesta
according to
nacional
the National
de
Assessment of
alfabetización de
Adult
adultos del
Literacy
2003. Sé que es un
from
número
since
viejo, pero
2003. I know it's an old number,
mucha información
but we
al
just don't
respecto.
have a lot of
En otras palabras,
information
casi 9 de
as to
cada
this.
10 adultos
But
en
in
los
other
Estados
words,
Unidos en el
9 out
2003
of 10 adults
podían
in
carecer o no
in
tenían
2003
habilidades para
didn't have
hacerse
the
cargo de sus,
ability
para leer
to
una
take care
receta,
of
para
their own health
alimentar.
or
Entonces
to
esto
read a
es grave,
prescription or
es
take
grave.
care of their health. And so
Entonces no hay
this is a
datos
really
muy
big deal.
importantes o muy
And so we don't
nacionales sobre
have
las habilidades de
national
alfabetización en
data
salud,
as to
especialmente con poblaciones nativas, americanas
as
o
to
con
the health
poblaciones
literacy
migrantes
within
o
this
con
country,
minorías, ¿sí?
especially with
Entonces,
minorities,
aparte de
with
eso,
Latin
son
American
las poblaciones con las
communities.
que nosotros
And
trabajamos.
so, and this
La
is the
alfabetización en
population that we
salud
usually
también
work with.
está muy
Also,
relacionada con
health
los costos.
literacy is also
Nos
related with the
interesa mucho a los
cost,
proveedores
and
de
that's
servicios
something
de salud.
that we
Costos
care for.
asociados con enfermedades
Costs that
crónicas,
are
costos
related
asociados
with
con otras
chronic
enfermedades que
diseases,
se
with
agravan
other
por el hecho de que no se
serious
sabe
illnesses,
manejar las
because we
medicinas o
may
no se
not be
sabe
able to
manejar el
manage
sistema de
the
salud. Y
medication
costos
or the health
elevados en
system.
el
And
uso
then
de
also
servicios de
high
urgencia.
emergency
Esa es una
service
de las
costs.
cosas
That is
más
one of
importantes y
the
que les
most
cuesta mucho
important
trabajo al
things,
sistema de salud
which is hard
entender
for
cómo
our
podemos
health
bajar los
system to
costos
understand.
y el uso
How
de
can
los
we
sistemas de
lower those
emergencia en
costs
este
for the
país.
high
Y bueno,
emergency
hay mucha otra
costs?
información. Yo
And so
les
anyway, we
encuesta
have
otra, que es otro
a few more
estudio de la
a
encuesta
little more
nacional
information.
más
I brought
grande,
to you guys a national
colaboradores,
assessment of
que hizo
adults
un
literacy.
metaanálisis y dice que el
They did
36% de los
an
adultos
analysis
en
that says
el
that
2018 ya
36% of the
tenían un
adults
poquito más de conocimientos
in the
básicos.
United
El
States
problema
had
es que
a
hay justa
basic
unión con
knowledge or
otros y
below
entonces el
basic
número es
knowledge
más largo,
of the
más
health
grande.
knowledge. And so
Pero
with that,
si
the
ustedes quieren
numbers
más
do
información,
tend to
vayan a
increase.
este plan
However, if you would
nacional
like more
para
information,
mejorar
please
la
go to
alfabetización
this
en la
website
salud
so
en
that
los
you can
Estados Unidos.
better
Ahí hay más
your health
información. Esto
literacy
es
in the United
solamente
States.
una
You
probadita.
can go ahead
La
and
otra cosa que es
seek this
importante
information.
considerar
This is
es
just a
que
little
el
taste of
sistema
what
de
we have.
salud en este
The
país
other
es
thing is
principalmente
considerations.
privado,
The
¿sí?
U.S.
Con
healthcare
algunos
system is
problemas técnicos.
primarily
No
private
existe
with some
cobertura
public
universal
programs.
como en muchos de
There is
nuestros
no
países, ¿no?
universal
Salud para
coverage
todos, el
system
seguro
like
popular
in
en un
many other
lado o las
of our other
vacunas para
countries.
todos en otro país.
Like, for
No es
example,
así. Entonces
vaccines or
venimos
other
de países
coverage in other
donde el
country. And so
sistema es
we
diferente.
come from
Aquí
countries
hay
where the health
proveedores de
system is a little
servicios de
bit different.
salud con fines de
There are
lucro,
also
es decir,
there
que
are
son
also
empresas
other
dedicadas a la salud,
for-profit and nonprofits
empresas,
healthcare
negocios
providers,
dedicadas a la
which
salud
could be
y otras que
businesses that
no.
are
Hay de todo, ¿no?
that dedicate to
Y
provide
existe un
health
sistema de
services.
salud, de seguro médico basado en el empleo.
There
Es
is
decir,
an
si usted trabaja,
employment-based health
puede
insurance
tener
system for
acceso
working
a
people.
esos servicios
In
de
other
salud
words,
a
and
través de su
if you
empleo,
are working,
¿sí?
then you can
Pero
receive these health
una cosa muy
services
importante,
through your
la
employment.
elegibilidad de los
Now, here's
servicios de
another
salud
important thing.
depende del estado en el que
Eligibility
usted viva,
often
¿sí?
depends on the
Entonces, eso es
state.
algo que tenemos que tener muy en
Now,
cuenta.
that is something that we need to
Además,
keep in
hay
mind.
servicios preventivos, hay
Also, they are
servicios de rutina, hay
preventative and
servicios
routine,
urgentes y hay
urgent, and
servicios de emergencia.
emergency services.
Y lo que se trata es de que los
And
servicios
what this
preventivos
means is that
aumenten
those
para que
urgent
los servicios de
services
emergencia
are more
disminuyan.
accessible than the
Esa es
emergency
la idea
services for
en
non-life
cualquier
threatening
sistema de salud, no
conditions.
solamente en este
And that is
país.
the ideal thing to
Los
have.
servicios de urgencia aquí en
Now,
este
the
país son más
emergency
accesibles
services
que los
are more
servicios de
accessible
emergencia.
here
¿Ok?
in this country.
Ahora, en todo el país han
Now,
crecido
in
estas
the entire
pequeñas
country,
clínicas,
these small
lugares donde usted
clinics
puede
have
ir sin
grown
cita, sin
where
nada
you
y
can
se
perhaps
atiende.
go without
Son
having an
para
appointment and they're
cuestiones
able to
donde
help you.
no
Now,
está en peligro la vida. ¿Sí? Entonces,
these are appointments where your
pues
life
bueno,
is not
hay que
in
saber
danger.
que la salud
And
es un
so
derecho
it's
universal.
important to know
Estas
that
son
health it's a
consideraciones que
universal
tenemos que
right.
tener en cuenta.
And that's just the consideration that
Por
we
otra
should keep in
parte,
mind.
nada más les voy a pintar esto
And
muy
also, I'm just
rapidito.
going to paint this
Quiero
really quick for
información
you.
más
If
dentro
you would
del
like more
PowerPoint, están
information
los enlaces.
on the PowerPoint, then you can go ahead and find the links on there. In the
331
United
millones
States, we
de
have
ellos, pero dicen que
333
ellos, el
million
13.5% de la
inhabitants,
población es
which
inmigrante.
means
De
that
estos
45
inmigrantes, el
million are
75%
immigrants.
viene de
Now,
Latinoamérica y del Caribe.
13.5%
¿Sí?
comes
Y tenemos
from
todo un
the
sistema de
75%,
entrada
I'm
de
sorry, come
visa, de
from Latin
trabajadores de
America
otros
and the
países. No voy a
Caribbean.
entrar
Now,
ahí.
some of them enter
Pero
through
bueno,
a
¿de
visa
dónde vienen
entry,
estos trabajadores?
and so,
Vienen
or
en un
temporary
gran
workers.
porcentaje de México,
Where are these workers
del
coming
Caribe,
from?
de
A lot of them
Centroamérica
come,
y de América
45%
del
come
Sur.
from
Y ustedes
Mexico,
saben por las
4% from the
cuestiones
Caribbean, 20% from
políticas
Central
que
America,
tenemos
11% from South
muchos
America.
inmigrantes de
Now, as
Venezuela,
many
por
of you guys
ejemplo,
know, we
y de
have a lot
otros
of
países
immigrants
que
from
están en
Venezuela and
condiciones
some other countries that are
precarias.
in
¿Sí? Y
precarious
bueno, el
conditions.
otro punto importante antes de
Also,
entrar
the other important
al
point
tema
before
cómic es que
we talk
el
about the
promedio de
comic book
escolaridad
is
y la
that
tasa de alfabetización en esos países de donde venimos todos nosotros
the
es más baja
schooling number
que
that we
en los
have
Estados Unidos, ¿no?
in these
Entonces,
countries are lower
todo
than
eso
in the
tenemos que
United
tener en
States.
cuenta
And
cuando
so
nosotros
this is
queremos
also very
dar
important when
acceso
we
o
want to
empoderar o
provide
dar
and
herramientas
empower
a las
people
personas con las que
and
trabajamos,
provide
¿sí? Que
tools with
son
those people
personas
that we work with,
vulnerables, que son
which are
personas que
vulnerable
no tienen
people
ciertos
and are
recursos o
people
que
that may not have
recién
certain
llegan a este país
resources
y
or people
enfrentan
that are
todas esas
newcomers to
cosas que
this
ustedes me
country
dijeron
and
al
that they
inicio.
are coming up
Y
with all
bueno,
of these things that you
le
guys
voy a dar
mentioned.
entonces la palabra a Marta, si me hace el favor. Hay dos preguntitas que
So
quiero
I
que
now
ustedes me
give the floor to
respondan.
Martha. There are two
Marta.
questions I want you to answer. So, Martha.
La voy a poner acá.
Okay, so I'm going to
Es
write
una
it
pregunta.
here or put it here.
¿Quiénes de
This is a
ustedes han
question.
utilizado
Who
libros
has
clásicos de
used the
MCN?
comic
¿Sí?
books from MCN?
Por favor, vayan a su pantalla y
Please use your screen and answer this. Thank you. The other thing is if they have been useful, because we devote a lot of time to do this. I'm going to give you a minute to answer.
¿Está teniendo respuestas, Marta?
Are you getting answers, Marta?
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 Perdón, estaba en silencio. Sí.
Sorry, I was
Gracias, señora
silenced. I
Enríquez.
was muted. Yes, almost everybody has
¿Puedo cierre
answered.
ya?
You want me to close it now?
Dele 10 segunditos más.
Give it 10 more
Tenemos
seconds.
85
We have
participantes.
85
Vamos a ver.
attendees.
Si gusta, Marta, mostrar los resultados.
Marta, can you display the results?
Eso significa que
Then this means
de los que respondieron,
from the people who responded,
30% sí los han
30%
utilizado, otro 30%
have
no,
actually used them,
y yo
another
los conozco.
30% no,
Perfecto.
and
Entonces,
there's people who
eso
do
es
not know
perfecto
about
esto
them.
para
Okay, then this is
que ustedes se
perfect
familiaricen con nuestros
for you to
materiales.
know about our
Y de
materials.
los que los han usado,
And
el
of those who
50%
have
dicen
used
que
them,
sí.
50%
Entonces,
answered yes.
vamos
Okay,
ahí
so
a ver. Gracias,
let's say
Marta. Eso
this.
está
Thank
muy
you,
bien.
Marta.
Pues bueno, les voy a
Well,
presentar entonces
I will
nuestra
now
última
show you
creación. Tardamos más de 6
our
meses en
last
hacerlo y
creation. It
está
took us
todavía en
more
los
than 6
últimos
months,
detalles.
and
Se
we're
llama
still
El
working
que
on the
busca encuentra
final
y es igual que
details.
todos
The
nuestros
name is Those Who Seek, Find.
materiales
And it's
educativos.
similar to all
Conectan
other
con la realidad,
educative materials. They
presentan
connect with
soluciones
reality,
prácticas.
they present practical
Tratamos de hacerlo de
solutions.
manera
We
clara,
try to do this
sencilla
in
y
a clear,
concreta,
simple,
porque
concrete
queremos
way
avanzar en la
because we
alfabetización.
want to move
Entonces
on
se llama El
in
que busca
literacy. So the
encuentra.
name, as I said, is
Es
Those
un
Who
libro que
Seek,
tiene
Find.
16 páginas
And it
y
has 16
se los
pages,
voy a platicar.
and I will
Esta
talk
es
to
la
you about it.
anteportada, que es un
So
espacio para
this
que
is
ustedes
the
pongan los
cover.
lugares y
So
que
this
dejen
is a
influencia,
space where you
¿no?
can write
Entonces la cosa empieza en
phones.
un sábado
This
en la
is behind
mañana,
the
en una
cover.
feria de
So
salud
everything
comunitaria,
starts on
y
a
pasa
Saturday
una
morning
pareja
community
y
fair, and you
en
see a
uno de los
couple coming
módulos
by. And in
está
one of
una
the
promotora y
modules,
una
we
navegadora,
have a
¿sí?
promotora
Y
and a
entonces
navigator,
se
promoter and
acercan y ella
navigator.
está
So
embarazada
they
y
walk
les
closer.
ofrecen
She's
información. Y
pregnant
ahí
and she's
empieza
been
el meollo del
offered
asunto. ¿Por qué? Porque
information. And
Ana
there
le
is
hace
where
una
we start
pregunta
because
clave
Anna
a ellos. Les
makes a
dice,
key
¿tiene
question to
seguro
them.
médico?
Do
Y
you have
toda la
medical
historia de ahí
insurance?
empieza.
And we get the whole
Entonces ellos,
story
¿qué es eso?
developing from
¿No?
that. from there. So they ask, what is this? So they start telling them about this contract between a person and a company to cover medical expenses when you are ill or injured. So this is a contract. You pay for a monthly payment and they provide you with the service when you need it. So this book is going to be available in English. As I was saying, it is like bread is coming out of the oven right now, and it will be uploaded to our internet site, I hope tomorrow or at the end of next week with the English version. It is already translated. We're just working on the final details. So I move on with the story. Turns out that they are explained this, and then they ask, but then we don't have that. And then the health promoter starts explaining how the health system works. So she explains that there are primary care places, community clinics, urgent care centers, and that it is very important, this urgent care, these three that we see on this page, when we don't have any risk to die. But there are others, which are hospitals and emergency rooms, where you are taken care of in situations when your life is in danger. So they are being explained this, and they tell them to go ask for support. And they say, I don't know how to read in English. I don't speak English. So what can I do? And so one of them provides them with a card of a program to language access so that they can explain that they don't speak either English or Spanish. And so the adventure starts there. They explain to them that they need a primary doctor appointment first. They explain to them how they can get medical insurance through their work, through their job, but they don't have any money to pay. So they speak about these payments on a scale and that every state is different. So the promoter and the navigator, these two health services providers of health, they take Norma's cases because she's pregnant and she does need the health services, and she's told step by step what is it that she needs to do. So they compare it to a labyrinth. Okay, this is what you need to do first. Then you need to obtain information about insurance. Then you need to place an application. Then you need an appointment with a primary doctor, and he will give you the referral. And yes, Barbara, it is very important to explain the difference between an urgency and an emergency. So if you get to see, this is a very easy case that we cannot relate to. Once all this is explained, they also realize Benito, Norma's husband, and Norma is a pregnant lady, is kind of sick. And they ask him, have you been taken care of? No, I won't be able to do it because my peer went to the emergency room and he had to pay an outrageous amount of money. And then she explains, well, this is what happened. A person should not go to the ER room. They have to go with the primary doctor or a clinic. And so they start speaking about which are the papers or documents they need to fill out so that they can get the medical care. So he's explained something important. The United States is the only country where you have to write first the month, then the day, and then the year. When they ask you for a date, this is your birth date or today date. So they are explained all these and everything they can use to prove their situation. So again, they take Benito's case to explain what is it that needs to do. Go to the health center, place your application, visit your primary doctor, and get a referral if needed. And well, the story finishes here. But then they are not alone. They have Luisito, their son, and the grandmother. So, well, they use this opportunity and they ask, how can we get Luisito vaccinated because he will be attending school? So along the way, they lost the vaccination proof papers of Luisito, and he needs to go to school, and he won't be accepted if he's not vaccinated. So what they do is they tell them that they have several points of access to low-cost vaccines or on a scale. They can go to the community clinics, they can go to the health fairs, they can go to the general consulate of their countries that sometimes have a health window, or they can visit a mobile clinic. So they are told that they need to have all this. And then they take the case again of Luisito and they tell him, well, they tell the parents which are the steps they need to follow for Luisito to be able to attend school. So while the only person remaining is the grandmother who was here, and she's asked if she can be taking her pressure. They say yes. She has some chronic diseases. She has arthritis, diabetes. But very funny, she says, I don't want to visit the doctor here because they won't even see me. The appointments are too long. I wait for I don't know how long, and then the doctor doesn't even look at me. So she expresses all her complaints, and they tell her, well, yeah, but that's the system. And we take her case. She's 87, arthritis, she's rheumatic, she has diabetes and hypertension. And she's told, or they are told, how they have to go through the labyrinth. So these two promoters, the health one and the navigator, explains that they always have to visit the primary doctor for them to be referred afterwards to the special services. So asking is key. So she takes advantage of this page to explain a little further what Medicare, Medicaid is, as well as the financial assistance programs, so such as CHIP. And so they identify each of the things that we have in an insurance card. What do they mean? As well as what a deductible is. They explain how they can actually look inside of the network for a doctor or outside. So these can be used as a poster also, this piece here, and be able to explain a little bit further. So, well, turns out everything is almost answered for this family. So these were 4 different cases, as you noticed. But meanwhile, we see arriving Wilmar. Wilmar Santos is a person who got to the United States very little time ago. He moves all the time, and he does not have any documentation to work in this country. So we cannot say the word, but we can say the characteristics. And so he gets closer, and the thing is, he speaks no English. And so they tell him again, this is what you need to do, and they recommend a health network that they have when they support people to look for a house or a place with physicians. So he's explained everything. He has to be explained. He feels he can trust, and he's given this number, 211, where you get information on housing and other services in your language, 911, which is for emergencies, and 988 for suicide prevention. And once they get all this information, he goes away, he's thankful, grateful, and he uses again the labyrinth to find out how they can help the person. And so here again, they locate first the services, find out if they have any medical services they can use, and then the story finishes when they are actually removing the module or the stand or however you call it, and they are happy because they did something good for their community. And so each of them is saying, sometimes we don't need to know everything, but we need to ask. Asking is key. We all have a right to health. And there's a lot to learn in this system to be able to navigate it. With this, I will stop to see your reactions in the chat. Please let me know what you think.
Dos corazones y unos aplausos. Muy bueno, explican
All
cosas
right, we got some
fundamentales.
hearts and claps, and so well that they're explaining fundamental things. And yes, we're going to be sharing the links with you. At the end of the week, we're going to be providing the information in English and Spanish. Someone said they loved it. Marie said, thank you. Someone said they thought of the whole family. Yes.
Pues sí. Marta, entonces ahora sí quisiera que
So now, Marta, I would like
los micrófonos
for you to open up the mics because the comic book is here, and this is a comic book that you can utilize. But yes, we thought it through. We did focal groups. We did so much work and research to come to this final work. And so at the end, I want to present this to you. This is a tool. Now we know the consideration, and now we want to learn what are some education strategies that you know. I know that many of you have so much more experience, maybe much more experience than what we have because you're working in that field. And so what are some educational strategies that you have or that you can share with the rest of the team?
Por favor, si ustedes quieren responder a la pregunta de Alma, pueden.
Also, if you would like to answer Alma's question, you can go ahead and raise your hand virtually, and I can remove you. I can unmute you, or you can also type it on the chat. So share with us, what are some strategies? For example, I know this gentleman that with a comic book, he created a puzzle piece and he was able to use this puzzle piece or this puzzle as a tool. And so Barbara is already thinking of creating another comic book to prepare for a visit with the doctor. Alma is saying that as they recruit, they share about the medical services. Someone else here is sharing about games, interactive games, and yes, because this is a good way. Anything that's interactive it's the best. Okay, what other strategies can you think of? The one-on-one. Yes. Let me share with you one that I use that works for me. If I go see a family, instead of dropping them in the waiting room, and I want you guys to see this, you know where I leave them? I leave them in the bathroom because sometimes it's in the bathroom where they read. Sometimes the parents read there because, and as a health promoter, then I can go every week and I can leave these resources in the bathroom. I don't have to share it all, but I can share things little by little. For example, if the family needs services from something specific, then I can leave the comic book in the bathroom and then they can identify what they need. Jose Rodriguez is saying that maybe some small life presentation. Francisco saying that the hand raise button is not working. Carolyn is saying that they talk about the resources and the available services for them. Someone else is also saying that they leave information as like asthma, nutrition, diabetes. Very well. Yes, they talk about outreach services. Yes, those are good. And yeah, many of you know these strategies. And so now the question is specifically, how could you use this comic book in your daily work? How could you utilize it in your daily work? Is there a way that you can utilize it?
No veo respuestas.
I don't see answers here.
Romana dice que les dan seguimiento a las familias por medio de juntas.
Romana
y
is
este es
saying
un
that
buen
they do
libro para
follow-up
presentarlo, ¿cierto?
follow-up meetings with family, and this would be a good
¿Alguien tiene algún
booklet to
sistema
present.
donde llegan personas a
Do
pedir
any of you guys
orientación?
have a system where you have people asking for
Y
an
de qué es lo que
orientation?
hay que hacer y dónde se les
And
podría
what are
otorgar este
things that
boleto
they
para
can do, and
orientarlos?
how can they have access to this
María
booklet so
Eugenia
that they can
dice
be
que
informed?
escuelas, que dentro de las
Maria
escuelas
Eugenia is
también
saying that
podría ser
perhaps inside the
utilizarse.
schools they could
Roxana
use it
dice
as
que el
well.
uno a uno para
Roxana is
explicarles
saying
el sistema de
one-on-one so that
salud.
they can explain to them
Y Nerelia, los
health,
eventos
how
de
the
las
health
ferias de salud.
system
Sí,
works. Someone saying on health fairs,
medios
yes.
sociales. Y es
Social
muy
media.
importante que aprovechen al máximo este
It's
tipo de
very
herramientas,
important
porque
that you
solamente
utilize these
dárselos
kind of
por sí
tools, because
mismo, igual que un
giving
folleto
this
y
to
una
someone,
infografía, no
it's
tiene el
just
mismo
as a
resultado que
flyer or
si
some
usted
information. It doesn't
le
have the same
platica,
result
le
as if you were
explica
to
o de su
share
propio
and to
ver y que
explain and to
usualmente
let them view it
entonces, esto se presta
and
para
be
una
able to answer
interacción
some of their
más
questions. And so
larga.
this
O sea,
booklet
eso es
really
bien importante.
allows you to have
Utilícenlo con
a thorough
interacciones más
interaction with
largas
them.
y a
And so
largo
use this
plazo.
booklet
¿Sí?
for to create an
Abdalis ya dice,
interaction
ahí
with them.
vamos. Abdalis ya quiere saber cómo los podemos ordenar. Ahorita vamos a ver.
Someone is
Joana
asking
dice que lo
right
pueden
here how
utilizar
they
los
how they can
community
order
workers
this
dentro
book.
de la clínica totalmente.
Someone is saying too that they can use it with the health workers in the
Joana
clinic,
dice
of
que en la
course.
clínica móvil, sí.
Joanna is saying maybe
Gaby
at a
dice que le
mobile
sería
clinic,
muy
of
útil.
course. And Joanna is saying that this would be super helpful for her.
Durante los eventos de outreach y cuando están facilitando el
During
acceso a los
outreach
cuidados
events
con
and when they're
familias prioritarias.
providing
Pues sí.
services
Francisco dice
to
que leerlo en
families.
grupo pequeño y después tener
Yep,
una
Francisco
conversación
saying here that
poco a
perhaps
poco y
they
que
can read it
compartan
in a
historias
small group session,
personales con el
and maybe
sistema de
they can
salud
share
y que
personal
compartan
questions that they
soluciones o
have
ideas.
had with the health system.
¿Cierto? ¿Cierto?
Yeah, this is really good, of course.
También Carolyn dice que cuando
Carolyn's
ellos van
also
a
saying that when they go
¿cómo se llama? A sus citas
their
médicas mientras están
appointments, to their medical appointments
mientras
while
están esperando.
they're waiting.
¿Hay algunos de ustedes aquí que estén en la
Are they any
frontera
of you
o que
here
estén
that
en
are
los
near the
albergues
borders
donde
or maybe
llegan
near
personas recién
the
llegadas y que
shelters
están
where you have new
pidiendo asilo político o
people
asilo
that
en
are new
general
here that perhaps are
o
seeking
tienen el estatus de
asylum,
refugiado
or
o
perhaps they have a
tienen una visa
refugee status,
H2? ¿Algunos de
or
ustedes
have a visa
tienen ese tipo de
H02.
población
Do you
como
work
su
with any of this
nacimiento?
population?
Sí,
Yes.
sí.
Yes.
¿Piensan que podrían
Do you think
utilizarlo ahí?
that you could perhaps utilize this booklet there?
Sí,
Yes.
Julia, Dalis, trabajadores
Julia,
con
Dalis.
H2A son nuestro grupo.
Yep, working with workers with an
Sí, Romana.
H2A. Yes.
Sí, Brenda,
Yes,
Bárbara.
for Brenda, for Barbara. Good. Yeah.
Bueno,
Very well.
la parte de este seminario es que
Part of the
ustedes
seminary
expandan
is that
las
you can
formas y que
expand
compartan entre ustedes
the ways and that
formas de
you can share
utilizarlo
amongst
con
each other
con
the
poblaciones
different ways that you
diferentes.
can utilize
Puede
this
ser,
with different
como usted
groups.
dice, incluso con
As many of
las
you guys
escuelas,
mentioned, yes, with schools.
escuelas donde están recibiendo personas migrantes
They are
o
schools that
en
are perhaps
proyectos de
that have
migrantes en los centros
migrant
de salud
families,
o en las
or
clínicas
perhaps
móviles,
migrants in the
donde tiene usted oportunidad
health
de ver a
clinics,
pacientes en un ratito,
places
pero
where
que
you
les
have an
pueden dejar esa
opportunity to
información y
maybe see
después
these patients,
regresar.
even if it's for a little while.
Clínicas de
Leave this
salud mental
information and then
y
they can
química.
come back. Yeah, mental health clinics. Yes.
¿Sí? Pues sí, hay muchas formas de poder
Yes, they are
utilizarlo.
many,
Y
many
sí,
ways
ahorita para las
where
personas
and
que
how
están
you can
pensando en
utilize this.
cómo lo pueden
And
ordenar,
right now, for those
ahorita
that are
vamos
thinking
a
how they
ver
can order
cómo
this,
vamos a poder
we're going to go ahead and
ir
explain that to you in a
recorriendo,
few seconds
reunirnos de nuevo y a lo mejor ver cómo les podemos ayudar con
and
eso.
see if we can get together with you guys and see how we can help you.
Voy
with this
entonces a
goal.
pasar a recordarles esto.
Now,
Nomás se los
I'm
voy a
going to go
recordar
ahead and
porque
just
yo sé que
remind
ustedes
everyone this, and I'm
saben
just
mucho
going to
sobre esto.
remind you this because I know
Bárbara
you
dice
know
que se le
a lot about
ocurre
this. Barbara is
que
saying
puede hacer un club con el
that
librito
perhaps
y
she
usar
can create a club with
el
this
libro de
booklet,
diabetes,
and she can maybe
el
have the
libro de salud
diabetes
mental que
book
va a salir
and maybe
pronto
the
sobre
book of
diabetes también.
mental
Triciana
health.
dice que si tenemos
Triciana
alguna,
is saying
si
that
lo vamos a traducir
any chance
al
if
creola
you're
y
going to
criollo.
be
Sería
translating this
fabuloso,
in
vamos a hablar.
Haitian or
Si
Creole.
ustedes tienen la traducción, nosotros podemos hacer
Yeah,
nomás
of course.
si ustedes tienen, si ustedes traducen el texto, nosotros
If
lo
you are
podemos
able to translate the
con el
text,
diseño pegar.
then with the design, we
Sí,
can go
sería
ahead and
fabuloso.
attach the
Pero
translation
bueno,
words on there. That would be great.
la parte importante, este libro está pensado desde la
An
educación
important
popular
part is that
para
this book
empoderar
is
a la
being
gente. ¿Sí? Está
written
pensado
from the
desde el
popular
hecho de que
education.
una persona con conciencia
It's talking
no se
about,
le tiene que estar
it's
diciendo
really
lo que
that,
tiene que hacer. Ellos saben lo que
that
tienen
you
que
don't
hacer
need
y
to
toman sus
remind
propias
people.
decisiones.
These
Eso es
people
lo que
make their
queremos.
own decisions.
Queremos
You
que
don't
ellos
have to be
sepan
reminding them
y
often. We
decidan
want them to
lo que
know
tienen que hacer.
and to make the decisions
Y
that they
que
need to make,
lo aprendan a
and
través
for
de
them
estrategias
to
que
learn
tengan
it through
sentido
strategies,
en el corazón y sentido
for
en la
them to
mente.
have a
Porque
sense in
aprendemos
their
con la
heart
cabeza
and
y
in their
aprendemos
mind,
también
because we
con el
learn through our
corazón.
heads, but
Entonces,
we also learn through our
estrategias
hearts.
donde
And so
participen, no nada más
these are
platicando, decir la
strategies
gente
where they
aprende
can
haciendo
participate,
o
not just explaining,
escuchando
because
o
some people
oyendo.
learn by
Hay
doing, by
muchas diferentes
smelling,
maneras, ¿no?
by
Entonces,
listening, by hearing.
a
So
veces
there are many
nosotros
different
preparamos
ways.
las cosas y
So sometimes we
no
prepare
somos
things
nosotros
and
alfabetizados en
we are
salud.
not health
Y
literate.
preparamos las cosas de acuerdo a
And
nosotros
sometimes
y
we
no de
prepare
acuerdo a las
things according
personas
to
con
how
las
we
que vamos a
understand it,
trabajar.
but
Entonces,
not according
tenemos que
to the
preparar
people
las
that we're going to be
cosas de
working with.
manera que sean
And
significativas
so
y
we need to be
relevantes
prepared
para las
things in a
personas,
way that
¿sí?
is
Aunque a
relevant
veces se oiga
and
mal,
that
aunque
it's
a veces no
significant
esté
for those that you're working with.
gramaticalmente correcto.
Even though
Lo
sometimes things are
importante
not
es
grammatically
que
correct,
pasemos el
the
concepto. El
important thing
concepto.
is that we
Nuestro
are
trabajo
passing
es
on the
como
right
un
concept.
intérprete.
Our
Un
work is
intérprete de
almost as an
conceptos
interpreter, but this
de
is an
salud.
interpreter for
Intérprete
health
del
concepts.
concepto, no
You
la
are
palabra, el
interpreting the
concepto
concept,
del
not
concepto.
the word in
Pues tenemos que
general.
recordar que
So
el
we need
lenguaje
to
es
be
una puerta de
mindful that
entrada.
the
¿Por
language
qué
is a
creen que
port
en
of
MCN
entry?
hacemos
Why
todos
do you think that
estos
at MCN we do all of
seminarios en
these
español?
seminars
Porque
in
si usted
Spanish?
está
Why?
trabajando con
Because
personas que
if
hablan
you are
español,
working with
usted
people that are
necesita
Spanish
escuchar los
speakers,
conceptos en
then you need
español
to be able to
para que
hear
los
these
pueda
concepts
pasar.
in Spanish so
Porque
that
si
you
le hago
can
la
relate
presentación
these
en
to them.
inglés y usted va
Because if I do the
y hace
presentation in
su
English
traducción,
and then
que
you go and
probablemente
do
sea
your
muy
own
buena,
translation, which it may be
que a
really,
lo mejor
really well done,
los detalles del
but
lenguaje no es
perhaps
lo
maybe
mismo,
that the
¿no?
language detail
Entonces,
may
es muy
not be the same.
importante el acceso
And so it's
lingüístico.
very important to
Es muy
have language
importante
access.
que hablemos en nuestro idioma.
It's important
¿Sí?
that we speak in our language.
Y la otra parte es que
And
ustedes tienen que
also,
darse
the other
cuenta
part
con
is
dos o tres
that you
palabras,
need to
ustedes se pueden
realize
dar
where 2
cuenta
or
en
3 words you
qué,
can realize
cómo ustedes tienen que desmenuzar los
how
conceptos,
you
sabiendo
need to
qué tanto la
dismantle
persona
these
entiende. Siempre
concepts,
hay que preguntar a la persona
depending on how much
que
people can
describa lo que
understand.
acaba de recibir
Perhaps you
para que
can
usted
ask
se
those people,
pueda
hey, can you
dar
describe
cuenta.
what
Es
was just
este
explained to
concepto que le
you,
llaman
or this
de
concept,
preguntar para retroalimentarse.
this concept that we called
Y
ask to
recordar
receive
que un
feedback.
mensaje pues no sirve
And
para
also
todos. Aquí
to
no
be
es de que
reminded
todos
that
van a
one
entender el
message doesn't
mensaje,
work
¿no?
for everyone, right?
Como se dice pan en
Like,
Colombia, como
how
se
do you
dice
say
pan en
pan or bread in
México, como se
Colombian, or
dice
how do you
pan
say
en
bread in
Venezuela,
Mexico?
es
How do you
bien
say bread in
diferente.
Venezuela?
Sí.
Those are all different concepts
Y
for
bueno,
each country.
¿quiénes pueden practicar la educación popular?
And so,
Pues no es solamente
who
los
can
promotores
practice
de salud,
popular
no son
education?
solamente
Not
los
only the
educadores,
community
también los
health care
doctores,
providers
también las
or
enfermeras,
health
también los
educators or
asistentes
medical
médicos,
assistants or
también las que están
community
enfrente, las
health providers,
recepcionistas.
but also
Todo
those that
mundo
are
podemos practicar
receptionists,
la educación
nurses.
popular.
Anyone can practice popular
Nadie somos perfectos,
education.
pero
None
podemos
of us
hacer
are
un intento
perfect,
y
but
aprender,
we can do our
porque nuestro
best and we
objetivo
can
es
learn,
que la
because our
gente se
objective
empodere
is
y
for
no nos
people to
necesite
be empowered, for them to not need us later on.
Y bueno, es importante recordar que el libro
And it's
cómico
also
tiene ciertos
important that this
elementos
comic book has certain
muy
elements,
importantes, conceptos muy claves del
very,
sistema de
very
salud,
key
que algunas
concept
de
in the
sus
health
páginas se
system,
pueden
and that
utilizar
many of these
solitas.
pages can
Usted
be
las puede
used
imprimir y
on
decir,
their
voy a
own.
hacer la
You can go
plática de
ahead
una
and
hora
print
nada más
these
en esta
out.
página.
Perhaps you can even
Cada
do
uno
a
de esos
1-hour
casos que usted
session
ve
with
en el libro
one
cómico
page.
puede ser una
Each and one of these
presentación de
cases
ciencia.
can be a
Entonces, siéntase en
presentation.
la libertad
And so
de
please
agarrar este
feel
libro
free
cómico
to
y
take
utilizarlo.
this comic
Pero
book and
una cosa muy
utilize it.
importante es que
However, here's a
tiene
very
que
important thing.
adecuarse al
You need
estado, ¿sí?
you need
Al
to
estado en el que usted se encuentre.
you need to
Y
be
en
able
este
to use
caso,
it
pues
and adjust depending on the state that you're
yo
working in.
quisiera que
And so
Pam nos
now
dijera
I
cómo
would like
es.
for Pam to
Yo
tell
quiero
us.
que ustedes se den cuenta que en California, en
I want you
Texas,
guys,
en
for
Maryland,
example,
en
to know that in
Massachusetts,
California, Massachusetts,
cómo
Maryland,
se
Texas,
aplica el sistema de salud
for
es
you
diferente.
to know
Pam,
that the
¿cómo
way you
es
apply the health system is very different
California?
depending on each
Buenos días,
state.
buenas tardes a todos. Bueno, en California el sistema de salud es
Good
uno de
morning,
los
good
más
afternoon,
grandes
everybody.
del
Well, in
país
California, it is
y
one of the
gracias
greatest
al
of the
Affordable
country.
Care Act o
And
también
thanks to the
como
CARE
muchos lo
Act,
conocen
as well
como
as many know it, Obamacare,
ahora muchas más personas
now way
pueden
more
tener
people
acceso
can
a
have
un seguro
access
médico.
to a medical
Y acá en
insurance
nuestro estado
coverage.
de
And
California,
here,
este
our state of
programa de
California,
Obamacare,
the
Affordable Care
Obamacare
Act, se
program or
llama
Federal
Cover
Care Act
California.
is called
Cover
Cover California.
California es
And
un
Covered
mercado
California,
virtual
it's a
donde
virtual
se puede
marketplace
entrar,
where you can
comparar planes
access,
y
compare
también comprar
plans,
planes de
as
salud.
well as buy
Y Cover
insurance plan.
California trabaja
Covered
junto
California
con
works together
Medi-Cal,
with
que es la
Medi-Cal,
versión de
which is the
Medicaid
version of
aquí en
Medicaid
California.
here in
Y
California.
las mayorías de los
And
residentes acá en
most
California
residents here in
pueden
California
calificar para un
can
tipo de
qualify
aseguranza,
for a
ya sea
type of
por el
insurance. This
trabajo,
could be
por
through
Medi-Cal
their
o
job,
por Cover
medical,
California.
or Covered
Y
California.
creo que algo muy importante
And I
aquí en
think something
California es que
important is
todas
that
las
here in
personas
California,
con residencia en
everybody who has
California
a residence in
y
California
cumplen con los
and is in
requisitos de
compliance
ingreso
with the
pueden
requirements of
calificar y
access can
recibir
qualify
Medi-Cal.
and receive medical.
Gracias, Pam.
Thank you,
Ahora,
Pam.
Elizabeth, ¿cómo son las
Now,
cosas
Elizabeth,
allá
how are
en
things
Maryland?
in Maryland?
En Maryland, de lo que conocemos,
Well, in Maryland,
por ejemplo,
for
está igual
instance,
como
we have the
Obamacare,
same
como California,
as
es
Obamacare in California,
similar.
is
Ah,
similar.
lo que se nos comenta es que
So what we are told
Maryland tiene la ley
is that
similar
Maryland
para bebés sanos de Maryland o en
has,
inglés Maryland Healthy Baby
I'm sorry, the
Act.
sound is going on and off. I cannot actually interpret.
Sí.
Y proporcionará tiene cobertura médica para personas
And the medical
embarazadas
coverage,
y, y para sus hijos
you
independientemente
get
de
coverage for
su
you and your
situación
children.
migratoria. Algunos puntos clave
And some key
al
points
respecto, esto
about
permite a
this
las personas embarazadas
is that
acceder
this
no solo a la
covers pregnant
atención prenatal, sino
people, not
también
only
incluye
prenatal,
cobertura de
but also
dental, de urgencias y de
dental,
salud preventiva.
urgency, and preventive health.
Sin embargo, en Texas,
Nevertheless,
de lo que yo conozco,
in
porque yo me
Texas,
ubico en Texas, es completamente lo opuesto. Yo sé que en mi entendimiento creo que no todos necesitan, no todos tienen la situación, tienen que tener, ay, perdón, me estoy atrabada.
Sorry, I got a little stuck here, but
No, no todos tienen la cobertura
not
de
everyone
estatus
has the
migratorio.
coverage
Yo sé que hay
or
algunos en Texas, no
for
sé si
immigration
también
status.
saben un poco
I
más
also
de la
know there's some people
seguro
here
médico en Texas, pero
in
sí,
Texas, and I
tampoco
don't know if you know how
he
the
escuchado
healthcare
en
in
Texas.
Texas works, but I know that it's a little bit
Muchas
more
gracias,
complicated.
Elizabeth. Sí, parece
Thank
ser
you
que
so much,
el
Elizabeth.
sonido no está muy bueno, pero sí. Entonces,
Yeah,
este
it
es
seems
nada
like
más el
sound's not
ejemplo
working
de
very well,
cuán
but this is
diferente
just an
puede ser en un
example.
lado, en otro y en otro. Y si ustedes se fijan, yo
And
me
if you can
evité,
see, for
nosotros
example, I
evitamos
avoided
llamarle Obamacare en el libro cómico, porque no queremos que la gente se
in
confunda
this comic
ni
book
que
because I don't
lo
want people to get
utilice
confused or
precisamente
to
en las
politize
condiciones en
it
las que se está dando,
in
se están dando en este país en este
the
momento.
conditions that
Entonces,
we're living
nada
right
más
now at this
hablamos
time.
del
And so
mercado
we just talked
de la
about
ley de cuidado de salud
the law of
a
the
precio bajo
healthcare
o accesible,
at
ese
lower
Affordable
cost or
Care
accessible or affordable
LCA,
care
¿no?
act, which is
Que la gente
LCO,
le llamaba Obamacare,
which people
pero
used to call it
es el
Obamacare,
sobrenombre,
but
¿no?
now, but that was
Entonces,
just
pero
the
realmente lo
initials
que
that were
es una
given to it.
reforma de ley
But
del
really what it is
2010,
now,
que es lo que
it's a
ahorita se
new law
está
reform since
peleando
2010,
mucho y
which
ustedes
is being
lo han de
fought right
estar
now.
escuchando mucho.
Many of you guys, I'm sure, have
Y
heard it.
todo esto pues es dirigido,
And
como
all
bien
of
lo
this
dijo
is,
Juan, por los
as
estados.
Pam mentioned it, it's
Sí lo
led by
creas, es
the
una
states.
plataforma para que
And
todos
really what
puedan
it is
entrar
a
y
platform
comparar,
that
comprar
everyone can
y
enter in, where
acceder a
everyone
servicios de
can
salud de
buy
acuerdo a
and
las
can
condiciones
access health
de cada
services
persona,
depending
¿no?
on the condition
María
of each
Eugenia habla
person.
de que si hay
Maria
algún
Eugenia is
sitio web
asking
donde pueda
to
ver que
see
existe en
if there's a
diferentes estados
healthcare
del país.
website
No lo tenemos en este momento, María
that exists in
Eugenia, lo
different
buscamos
states of
y
the
si hay
country.
algo,
Maria Eugenia, we don't
se lo
have it at the
podemos
moment, but
pasar.
we will
Pero
look for it, and if we
cada
find it,
estado,
then we
¿verdad?
can provide it to you. But again,
Lo
each
va a
state
dirigir. María
will
Eugenia
lead
dice
this.
que se puede
Maria
utilizar
Eugenia is saying that they can use
Sí,
healthcare.gov.
sí,
Yes,
para ver lo que hay
okay,
en cada estado.
to be able to see what you can access in each state.
Ajá. Cancer Triage tiene algo. Muy bien.
Triage Cancer also has something. Very well.
Pues para terminar,
Very well. And just to
miren,
end,
estas proveedoras de servicios de salud nos
see, these
dicen
healthcare
que
providers
tenemos que
are
recordar
telling
a la
us
gente
that
y
we need
nosotros
to
mismos
remind people in
que hay que
ourselves
acercarnos y preguntar. Si nosotros no
to
sabemos,
come close and ask
hay
questions.
que preguntar.
If we
Las
don't know
personas les
something,
debemos
ask
de
questions.
decir que escojan un médico
We
primario, que es
need
bien
to ask
diferente, que no se puede ir a
people
un
to choose a
especialista
primary
inmediatamente
care
y que no
physician.
hay que
We don't need to
ir a
necessarily go to a
urgencias.
specialist or need to go to
Es muy
an
importante
emergency
tener
room.
visitas
It's
anuales
important for us to do
preventivas.
annual
¿Sí?
checkups,
Que
preventative annual
el
checkups.
médico primario lo manda al
And
servicio
the
del especialista. En Puerto
primary
Rico le
physician will
llaman
send them to a
referentes.
specialist if
En
they need to.
México
In
le
Puerto
llaman
Rico, they call it
referencias. Eso es lo que
reference.
hacen los
In
médicos
Mexico, they call it reference
primarios
as
o
well,
los
and
médicos familiares.
that's what
Hay
primary
que
care
hacer
physicians
énfasis
do.
con nuestras
And so we
personas con las
also
que
need to
hablamos que una
emphasize
urgencia
with those
no es lo
people
mismo que
with
una
our people
emergencia, ¿sí?
that an
Y que
emergency is
los
not the
cuidados
same as an
preventativos se ahorran
urgency,
dinero,
and that
tiempo y
preventative
esfuerzo.
care
Sin
will
embargo,
save
hay que
you
tener en
time,
cuenta
finances,
que
and
muchas de nuestras
efforts.
poblaciones
And so it's
batallan para ir
important
con el
that
médico por muchas y
some of
diferentes barreras
our people have
ustedes ya les
barriers as
pasaron.
to attending a health
Y que
provider,
las
as many
salas
of you
de
guys know.
emergencia en los
And
hospitales atienden
hospital emergency
situaciones que
rooms will
ponen en
handle
peligro la vida. Si
life-threatening
le da una gripa,
situations.
si le
Now,
da
if
una
you
tos,
have a
vaya a otro
cold
tipo de servicio,
or
pero
something that's minor,
el
go to
servicio
your
en
care
teoría no se
physician.
le puede
But
negar. ¿Sí?
in general,
No
they
se le
will
puede
not
negar.
deny services to
Romana
you.
dice que recordar que la
Romana is
aplicación
saying
es un
that
proceso
remember that
y
the
que debemos darle
application is a
seguimiento.
process
Tiene toda la
and that we
razón.
need to do follow
Mandar
up.
lo
And
que nos
yes,
pidan si lo
and to
tenemos y
send
es porque
anything
sí.
that we
Ya
have
esto no es pan caliente.
or
Tenemos que
anything that they're
quedarnos.
asking if we have it. Yeah.
Lo otro que hay que recordar es que las clínicas
Another thing that we need
comunitarias
to
para
remember
nuestra
is that those
población son una
community
alternativa
clinics
para servicios
are an
de
alternative for
bajo
low
costo.
cost
¿Sí?
services.
Entonces, esto es lo que hay
And
que
so
tratar
these
de
are things that we
pasar
need to
con este
try
libro cómico o a través de este libro
share through this
cómico a
comic
las
book,
personas
or
recién llegadas a este
especially to
país o que
those
están
people
buscando
that are new
asilo
to
o que
this
están
country, or those that are looking
en una
for
situación
asylum,
precaria,
or those
¿no?
that are in a
Ahora,
precarious
para ustedes, ¿sí?
situation.
Que es muy
And so
importante
for
el
many of you
estatus
guys, it's
migratorio,
very
porque
important.
antes de que ustedes
Legal
den
status is
una
important. And before
referencia o que den un
you
consejo,
provide a
que tengan
reference or
en cuenta el
even
estatus
advice, to keep
migratorio,
in mind
¿sí?
their legal status
Para que puedan
so
dar
that
consejos adecuados.
so
Es
that you can
importante que
give the right
nosotros
advice.
aprendamos sobre los
It's
seguros médicos
important
del
that we
estado en el
learn
que
about
trabajamos,
healthcare
¿sí?
insurances
Esa
depending
tarea
on the
nadie se
state
las va a
that we
quitar a
are
ustedes,
working in.
que hay
And
que
that's a
prevenir
homework that no one can take
el
away from
uso
you.
de los
It's
servicios
important
de
that we
emergencia.
that we can
La
utilize the
forma en
use
cómo se
of
hace esto
healthcare
es acudiendo
insurances,
al doctor,
the options that each
usarlo
state
solamente
has,
cuando se
to see a
necesita.
doctor when
Y en el
needed, to
caso de
prevent
nosotros,
necessary use
hay
of
que
emergency
aprender toda esta terminología
services.
básica,
And it's
¿no?
important that we learn this
Por
basic
ejemplo, jaundice es
terminology. For
ictericia, que es cuando la
example,
gente se pone
jaundice means
amarillas.
ictericia, which
Y
is
son
when
a lo mejor
someone
cosas
has like a
pequeñitas,
yellow
pero que uno
pale
tiene que ir
color.
poco a poco
And these are small
aprendiendo.
things, but we need to slowly be learning them.
Y por último,
And also,
explorar
just to end and just to
mayores
explore the
información
local
que quienes usen
resources.
este libro
I want to
cómico
invite you that for those
busquen
that
y
use this
tengan, si
comic
los
book
usan
to
en módulos,
search, to search
tengan los
for, if you
servicios,
use it in
los
these
números de
modules,
teléfonos de las personas
for
que
example, the phone
a
numbers
donde los van a referir.
of
Si
those that
es
you're going to be
el
referring them
mercado,
to. If it's in the market,
hablen. Si es a la
then
clínica,
talk to them.
hablen
If it's
primero.
to a
Si es
clinic, then
a
call
cualquier
first.
organización
If
que puede
it's to a
tener
certain
programas
organization that may have
para
programs
asistencia
uh,
financiera, hablen
where they
primero
can
para
qualify for
que
financial assistance,
sepan que les
then
van a
call first
responder
so
y que
that
les
they
van a
know that
responder
they're
en el
going to
idioma
be
de
answered and
ellos.
that they're going to be
Entonces, esa tarea
spoken to in the
nadie
language
se la
that
va
they
a quitar y
understand.
por eso
And
está
so
este
that's
libro
homework
para
that
que
you can
ustedes
always
lo
do
lleven
ahead
y
of
se lo
time.
den extra a la
And
persona.
this is
Y pues
something that
bueno,
you
aquí
can
están
provide to
algunos
them ahead
sitios
of
de
time. And
internet donde ustedes
also
pueden
here we're
encontrar
providing a few
toda
websites
esta
where you
información.
can find all of this
Y con
information.
esto,
And with
pues
this,
queremos ver si tienen alguna
we want to
pregunta o
see if you have
comentario.
any questions or
Marta, no se
comments
pudieron
before we
abrir
end.
los
Martha's
micrófonos,
saying,
¿cierto?
oh, the
No se
microphones
pudieron.
weren't able to
No sé
turn
por
on,
qué.
correct?
Disculpen.
No, I'm
Bueno, entonces
sorry.
si
We
hay
weren't
alguna
able to do
pregunta
that.
o comentario, por
But
favor,
if there's any comments or
con gusto.
questions, please go ahead and write those down on the chat.
El de diabetes dice a Zenet que utilizó el libro cómico de diabetes de Oregon. Bárbara dice que hay un plan
Barbara
local
says
en el
there's a
lugar donde
local
viven.
plan where she
Hay que
lives.
informarse de todo eso
Yes, you
para
need to
darles
be
a las
informed
personas
of all
información.
this to provide information to everyone.
Gracias.
Thank you.
Bonito material. Gracias, Natacha.
Great material. Thank you, Natasha.
Y la tarjeta que hicieron ahí son
And the
las que son de
card that
CDM.
was made there was the ones of CDM. Yes, you're right.
Bueno,
Okay.
otro material increíble. Gracias,
Another
Julia.
incredible material. Thank you.
Bueno, ahora aquí la buena noticia.
Now, the good news here is,
Gracias, Rachel. Sí, para nosotros es un gusto
thank
hacer
you,
este tipo de
Rachel. For
material.
us, it's wonderful to
Y
create
lo
this
más
kind of
importante es que
material.
vamos a imprimir
And
una
what is
gran
more
cantidad,
important
bueno,
is
no es
that we
una
will
gran, perdón,
print
una cantidad
an
limitada
amount, a
de
limited
estos.
amount
Entonces
of
van a
them.
recibir
So you
ustedes,
will be
y si me hace el
receiving,
favor, Marta, de
if
ponerla
Martha
aquí,
can
el
put it
enlace
there,
para la evaluación.
the link for
Tiene
the
dos partes
evaluation.
esta evaluación.
This evaluation
Una
has two
evaluación
parts.
del
It has
seminario que ustedes
the
acaban de
seminars
recibir
evaluation
y
that you just
tiene
received.
después de
And
eso
there's,
hay una
beside this,
solicitud.
there's
Ustedes pueden
a
solicitar estos
request
libros
for you
cómicos impresos.
because you can
Pero
request
tengo
these
que
books
decirles, no
printed.
todo el mundo va
But
a
I
tener.
have to ask
Hay un
you, I have to
máximo
tell you
de
this, not
200
everybody will
libros
get it.
que
We have
pueden
a
recibir, pero
maximum
se
of
les va a dar
200
prioridad
books. But we will
a las
provide a priority to
organizaciones que están en la
the
frontera
organizations
o que
who
son
are in the
albergues
border
o que
or who are
reciben
shelters or who
personas
receive
que recién
people
llegan,
who just
inmigrantes,
arrived,
refugiados,
migrants,
expatriados, y
refugees,
entonces en
people
esa
requesting
solicitud
asylum.
yo
And
quisiera
so
que
in
ustedes
this
supieran cómo los van a
request, please
utilizar
let us
y se
know
los
how you
vamos a
will be
mandar
using
sin
them
costo,
and
¿sí?
you will get
Les
them for
vamos a
free.
avisar.
We will let you know.
Esta aplicación se va a cerrar en
This
24 horas, es decir,
application of
nada
request
más
will be
de
closing in
aquí a
24
mañana
hours, only
quienes
today until
puedan
tomorrow.
llenar la
Those
evaluación
who can fill
y
out
la
the
solicitud,
evaluation and the request,
nombre, dirección
name,
postal, no P.O. Box, por favor,
postal
porque
address,
si no,
no
no se
PO
pueden enviar
boxes, please, because we
y se
cannot
los
send
hacemos
it.
llegar. A
And we
quienes
will
reciban
send
esto,
them
nos
to you.
vamos a
Those who
reunir
receive it,
después
we will have
en una
another
ocasión
meeting at some
y
point
para ver si necesitan algún
to
apoyo y
see
ver
if you
cómo
need
les ha
any
servido
support
el
and
libro.
find out how good it's
Y
been for you.
pues la otra parte es que, como decía una de las compañeras, podemos hacer la traducción
And as
a
the
creole
person was
haitiano, si
saying, we
ustedes
can
tienen esa
actually do the
posibilidad para que
translation
se pueda
to
poner en
Haiti
diferentes idiomas.
Creole
Recuerden que
language
esto es
if we
apenas
have
la
the
entrada.
possibility.
Hay
So this is
muchas cosas
just
dentro del
the
sistema de salud,
access
pero
to
esta
it.
es la
There's so many
entrada
things.
a ello.
This is just the
Y
beginning. There are a lot of things about health. This is a free access material. Once you get it on the internet, you can download it. The health centers who would like to print by themselves some of these books with your logo, you can go ahead and do this, writing before to us because we have a format. So you can print it.
No sé si hay alguna otra cosa.
Do we have anything else?
Gracias, Noel.
Thank you, Noel.
Julia.
Julia, yes, a reminder. A lot of health centers have as mandatory to provide interpretation services to the language you prefer. Thank you, Julia. Spanish, Portuguese, any language, Nahuatl, Korean. If they receive federal funding money, they have to comply with these language access requirements. This is a very important situation. If you are denied access, there are processes to actually place a claim, and we can let you know if they are not in compliance with this right of yours. We can do something for them to do it. I don't know if this is being said. Otherwise, please say it in the recording. Yes. What Julia mentioned, yes. Thank you. And well, so I only, well, we're going to leave here the Zoom open for a little while so you get to see this, but we only want to say thank you. This is the material. Do what you need to do, adapt it, and let's get educated ourselves first and educate the other people. So here we see again the request for the comics, and I'm going to leave here this screen so you can have access to it, or you can see the link on the chat. If you can put it again, please, it'll be fabulous. And please remember, later today, you will be remember an email to follow up. And in this email, you will get the links to the narration, and you can request your books. Yes, Maria Eugenia is asking if instead of hard copies, they can get the PDF via email. Yes, of course. Please send us an email address. Alma Colmenero, please write down your email so that someone like Maria Eugenia can write to us specifically that they want the PDF via email. Raquel is asking for the same thing. She says PDF would be enough. Okay, I agree. So that you get the books for the people on the border or the centers who need more. Thank you. Exactly. And well, with this, our time is over. To respect your time, thank you so much. And remember, if you have any question, send us an email. We're here at your service. Thank you. See you next time. Thank you.